Now let's look at the hyoid muscles. So the hyoid muscles are muscles that are attached to the hyoid bone. So this is the hyoid bone. It's like right where your neck is. And so what the muscles do that are attached to the hyoid bone is that it helps you open the mouth. So if I want to yawn or if I want to open my mouth completely, open my mouth really wide, it's these muscles over here that are attached to the hyoid bone that allows me to open the mouth. Because remember, when we're looking at the muscles of mastication, what they do is they elevate the mandible, which means they close the mandible, they close the jaw. But if you want to open the jaw, right, if you want to open the mouth, or if you want to depress the mandible, which also means opening the mouth, then there are some muscles that are associated with the hyoid bone. So there are two categories of muscles. There's the suprahyoid muscles and there's the infrahyoid muscles. And the way to remember this is that supra means above. So muscles that are above the hyoid bone. So if you look over here, these are the hyoid bone, and there are 4 muscles that we see that are above or suprahyoid muscles. Then we also have infrahyoid muscles, and infra means inferior or below. And we have 4 muscles that are below the hyoid bone. So all these work to, and we will look at their action too, but all these work to pull the hyoid bone, pull the mandible down. It can pull this hyoid bone down if it needs to as well. So let's look at the first muscle. And the first muscle is the suprahyoid. It's a suprahyoid muscle, which, so again, supra means above, hyoid refers to the hyoid bone. And so the first one we're going to look at is the digastric muscle. And the digastric muscle, if you look at how the name comes from, it comes from digastric. And digastric refers to, if I look at the mandible, which is right over here, there is a digastric fossa. So on one end, the muscle is attached over here. And then on the other end, it's attached to like the temporal bone. There's a notch in the temporal bone, and that's where it attached to. So it kind of dips like that. So digastric muscle. And what does this do? Well, this helps retrude the mandible, which means that if you want to push your mandible back, you want to pull your jaw backwards, it will help retrude the mandible. And it also pulls the mandible down. It'll also open your mouth. Okay, so this muscle pushes your mandible back if you want, and it can open your mouth. It can open the mandible. There is the myelohyoid muscle. And again, when you look at the word myelo, comes from the term myelohyoid line, which is right here. There's a line on the mandible on the inside. So the muscle attaches, one end over here, and the other end attaches to the hyoid bone. So myelo refers to a muscle attaching here, and then it ends where? In the hyoid bone. So right over here. And again, it depresses or opens up the mandible, opens up the mouth. Then we have the geniohyoid muscle. And the geniohyoid muscle is located, if I look over here, is this one right here, straight line. And you can see it's attached to, if you remember the mandible, let me show you a picture of the mandible. Let's see if I have a better picture. So in over here, this is like these bumps that you see here is known as the genial tubercles. And so the geniohyoid muscle is attached to the inside of the mandible, like right here, and then to the hyoid bone. And that's how it comes up with the name. Genio from the genial tubercles and hyoid for the hyoid bone. And what does it do? Well, it does the same thing in that it depresses the mandible. It'll pull the mandible down. Lastly, the last muscle that is above the hyoid bone is the stylohyoid muscle. And the stylohyoid muscle, this is, remember, the styloid process, right? And I think of it as like a stiletto heel, right? It's kind of like ST for styloid process, ST for stiletto heel. So it's like a heel sticking out, and the muscle goes over here, attaches here, and then it goes to the hyoid bone. And the stylohyoid muscle is a muscle that pulls the hyoid up and back. So basically, it helps with the hyoid bone to pull it up and it pull it back as well. Then we're looking at the infrahyoid muscles, and the infrahyoid muscles, again, there are 4 muscles that are associated with the infrahyoid muscle. Remember, infra for below, some muscles that are below the hyoid muscle. And again, when you look at their name, you can say stern. Where it says sterno, that means it's attached to the sternum, right? Sternum. And hyoid means it's attached to the hyoid bone. So just know that there are some muscles located below the hyoid bone, which are listed over here. The last muscle that I want to talk to you about is the SCM, also known as the sternocleidomastoid muscle. And the sternocleidomastoid muscle is known as a neck muscle. And the way it gets its name is that the S comes from sternum, and so sternum is this middle part right here that we see over here. So we can see one muscle attached to one end of the muscle attached to the sternum. Another end of the muscle is attached to the clavicle, and the clavicle is also known as cleido. And then we have the mastoid. So the mastoid process is right here. So the other end of the muscle is attached to the mastoid muscle, and that's how it came up with this name. Sternocleidomastoid muscle. This is often involved in pain. So if we have neck pain, maybe this muscle could be a factor. It could be inflamed, and that could be why someone would have neck pain. All right, good job, you guys. I hope you have a better understanding of all the muscles now.